Hey everybody, we're going to talk about uh, bisphosphonates and their mechanism of action. Sorry, I have two screens. I'm looking back and forth and I got distracted. So let's talk about what they do. And they have two basic functions: inhibition of calcification when given at high doses, and inhibition of bone reabsorption. So these are the drugs that we are going to give patients who suffer from osteoporosis, right? And essentially, these drugs target areas of higher bone turnover. And the osteoclast cells, which break down old bone, absorb the bisphosphonate drug. Boy, that's a mouthful. And their activity is slowed down and it reduces bone breakdown. So it helps to slow down the process a bit, right? And so its primary action is to inhibit osteoclastic bone reabsorption. And these drugs can reduce calcium by inhibiting bone reabsorption. And it prevents osteoporosis by actually slowing down or stopping the natural processes that dissolve bone tissue. And there are a lot of drugs that and conditions that promote bone breakdown. Steroids is a big one. Big one. So the judicious use of steroids is always important. Breast cancer drugs, prostate cancer drugs, heartburn drugs, Depo-Provera, excessive thyroid hormone replacement, anti-seizure medicines, blood pressure medicines. They can all be responsible for worsening bone density. Now, the thing with this one is when a patient takes this drug, they have to stay upright and not lay down for at least 30 minutes or until the first intake of food for the day. And this is to reduce esophageal irritation and ulceration. You don't want to use milk or milk products, coffee, orange juice, and food initially for the first 30 minutes because it can decrease absorption, and we don't want that. You want to use this drug in addition to calcium. So you want to use calcium with this. They work together to prevent that bone loss. Or one is bone building, right? Some complications to using these drugs can be itchy rashes, photosensitivity, sore mouth, flu-like symptoms, and bone pain. But bone pain is most common when it's given through IV. And the long-term effects of this can be osteocrosis of the jaw and atypical femur fracture. They advise that women at high risk can take this for up to 10 years, IV drug up to 6 years. But fracture risk should be reassessed every 2 to 3 years. They should be taken with a full glass of water. When taking these drugs, you want to be cautious about using non-steroidal anti-inflammatory drugs and some antibiotics with it. Um, mineral oils, heartburn medicines. So they may interact with these medications. So you want to, the judicious use of those drugs is important. All right, some examples: Boniva, reclassed. I think that Fosamax was taken off the market. So that's just a couple of examples of them out there. So education of the patient: they shouldn't lay down for 30 minutes after taking it. Do not take it with milk. Take it with a full glass of water. Um, Avoid the use of NSAIDs. And if they're on antibiotics, make sure that the physician knows that they are on this medication. So I think those are the most important points to discuss with the patient in taking these drugs. About endocrine pancreatic enzymes. Now, the pancreas has dual roles. It's an organ of the digestive system and also the endocrine system. The exocrine pancreas produces enzymes that help to digest food, particularly protein. And the endocrine pancreas makes the hormone insulin, which helps control blood sugar levels, right? So it works, there's a double purpose to it. Uh, the pharmacological action of pancreatic enzymes, and I'm going to butcher some of these words for sure. Pancrelipase is in a class of medications called enzymes, and pancrelipase acts in place of the enzymes normally made by the pancreas. It works to decrease fatty bowel movements and to improve nutrition by breaking down fats, proteins, starches from food into smaller substance that can be absorbed from the intestine. So that's a drug. That's an endocrine pancreatic drug. Think about what that drug would be used for and who would benefit from using that drug. For sure, cystic fibrosis patients, right? All right. The endocrine pancreas is composed of nests of cells called islets of Langerhans, which comprise about 20% of pancreatic cell mass. And those islets of Langerhans secrete insulin, glucagon, somatostatin, and pancreatic polypeptide. So that is about 20% of what the pancreas does. The CCK and secretin are the major hormonal regulators of pancreatic secretion. CCK influences pancreatic secretion by activating afferent neurons within the enteric nervous system. Secretin acts directly on the pancreatic duct cells and synergizes with the effects of an ACH or acinar cell. Now let's talk about that endocrine pancreas. The endocrine part of the pancreas comprises the islets of Langerhans that release insulin and glucagon directly into the bloodstream and help to regulate blood sugar levels. Now, if you're going to be giving a patient pancreatic enzymes, it might take a few days for them to begin to work. We advise patients to keep a food diary so that they can see if their symptoms are improving. And this is a huge process. Pancreatic enzymes are activated in the lumen. Trypsinogen is activated by duodenal enterkinase into trypsin, which activates pancreatic enzymes, and it performs nutrient digestion. So the pancreas is so incredibly important. So when it's not working properly, it affects the entire system. All right, let's see. let's talk about this. Now, not only do people with cystic fibrosis have issues, but there are a lot of other conditions that would necessitate assistance with the pancreas, pancreatitis being one of them. And some of the signs that there's something wrong with the pancreas is the patients, they look sick. They've got a fever, nausea, vomiting, sweating. They can have clay colored stools, bloating, and fullness also. Okay. Okay, some of the brand names of drugs that help the pancreas are Creon, which is probably the most popular one, Palcaps, pancrease, pancrelipase, and ultracaps. So those are just a few. So Creon is a prescription medicine used to treat people who cannot digest food normally, like cystic fibrosis or those who have chronic pancreatitis or some other sort of pancreas issue. And the primary management strategy is to use prescription pancreatic enzymes and take them with meals and snacks and fat containing oral nutrition supplements to mimic the pancreatic exocrine function by providing amylase, lipase, and protease. Now, these drugs are very expensive. Let's talk about one of the drugs. PERT ranged from a 30-day supply, 2,000 to 4,800 dollars of cost. So that's crazy. Creon, which is probably the most common one, is about $876 for 100 capsules. Now, when you're taking these drugs, there are certain medications you have to be very careful um, with, like antacids, Tums, Malox, those sorts of things, and certain diabetic drugs like Arcarbos, which I've never heard of before, and Migatol, which I've never heard of before either. But typically, calcium and magnesium containing antacids, it will decrease the effectiveness of the enzymes. So don't want to do that. When you take the medication, if you take Creon, it has to be taken with the cool drink. Hot drinks will inactivate it. Now, part of the monitoring process for patients who are taking these enzymes is some tests. One of them is the fecal elastase 1 fecal fat measurement and fat soluble vitamin measurement. So this is a measurement in the stool. You want to monitor abdominal symptoms, nutritional intake, weight growth, stool character, and if there's any fecal fats. Some of the side effects of these enzymes are stomach aches, nausea, vomiting, diarrhea, constipation, cramps, gas or bloating, and headache. The standard dose of lipase, well, I don't know if I've got lipase here, is 50,000 IU of lipase with meals, 25,000 with snacks, but that's the UK guidelines. So our guidelines recommend 40 to 50 per meal. Okay, so that's a little bit different than the UK guidelines. All right, I think that's about it. And something that you need to know too is that the exocrine pancreas can regenerate spontaneously. So it can begin working on its own again. Um, and we just hope that that happens. But we do have treatment for patients um, that are experiencing these sort of symptoms. So I hope that this helps on endocrine pancreatic enzymes. All right, let's talk about dipeptidyl peptidase 4 inhibitors. And you might say, what the heck is this? But it's not as complicated as you think it is. Think of Januvia. And Januvia is a drug. It's not brand new, but it is relatively new. Um, and it works by interfering with the body's hormone glucagon, which would normally keep blood sugar levels higher. To get more in depth or more scholarly, these drugs inhibit the degradation of the incretin's glucagon like peptide 1, or GLP 1, and glucose dependent insulin tropic peptide GIP. And the first ones that were available were sitagliptin and vildagliptin. Okay, but Januvia is the one that we see most of the time, at least me. At least that's what I see. And these were approved by the FDA back in 2006. So they're new, but not so new. Okay. Okay. So precautions for patients with these medications are pancreatitis, heart failure, renal failure, hypoglycemia with concomitant use with insulin, hypersensitivity reactions, severe and disabling arthralgia, bullous, pemphigold, and so those are things that we would definitely monitor. And check your blood sugar, stay on prescribed diet and exercise, talk to the doctor on managing low blood sugar because that is a risk with these drugs is um, low blood sugar. This drug should not be used in patients with type 1 diabetes or pancreatitis. And I see here that Januvia was taken off of the market in 2023 due to increased cases of pancreatitis. So I don't know if that's back in the market or if it has been replaced by drugs like Ozempic and Jardiance. It sure sounds like it has been because you don't really hear about Januvia too much anymore, right? So that's some information about this classification of drug. Right, let's talk about biguanides now and what is going on with them. Why do they work? How do they work? They lower blood glucose levels by decreasing the amount of glucose your liver produces and releases into your bloodstream. So a little more in depth um, in the pathophysiology or the physiologic process. It displays an inhibitory effect on complex 1 and inhibits the rate of oxygen consumption, thereby causing energy stress, increasing AMP ATP ratio, and activation of AMP kinase, which is believed to be a master mediator of the therapeutic effect of these drugs. So, pretty important. So, this is a class of medication used to treat type 2 diabetes, working by reducing the production of glucose that occurs in digestion. Metformin is the one that we use in this country, and lots of people are on metformin, a lot. And metformin works by helping to restore the body's response to insulin. It decreases the amount of blood sugar that the liver produces. We spoke to that already. Side effects most commonly are GI, diarrhea, cramps, nausea, vomiting, and gas. And long-term use has been associated with a decreased absorption of vitamin B12. So these patients may actually need um, supplementation of vitamin B12. All right. Metformin can interact with some diabetes medications that decrease blood glucose, like insulin, glipizide, repaglinide, and it can also interact with medications that can raise blood glucose, like prednisone or hydrochlorothiazide. You want to avoid metformin if you have uncontrolled diabetes, liver or kidney problems, severe infection, heart failure, or a recent heart attack. Contraindications for taking metformin: impaired renal impairment with an elevated serum creatinine level more than 136 in men, 124 in women, congestive heart failure, and advanced age more than 80. So, all of these things, you've got lots and lots of stuff to discuss with your patient, such as diet. They want to stay away from foods high in simple and refined carbs, trans and saturated fats, foods rich in sodium, because that can elevate glucose levels. They should avoid certain foods while on metformin, like alcohol. Alcohol can actually lower their blood sugar. High sodium, metformin will reduce the amount of glucose your liver releases. Saturated fats, refined and simple carbs, sugar, overprocessed foods, and fried foods. It's not a good idea to take prednisone when you're on steroids. Furosemide, some high blood pressure medications, and testosterone or progesterone. All right. So I think that we have covered the basics of this classification of drug, and hopefully will give you a greater understanding of um, of metformin. All right, let's talk about thyroid agents. And first of all, when we're talking about thyroid agents, we're talking about two different hyperthyroid and hypothyroid. Hyperthyroid, of course, is too much, and hypo is too little. Antithyroid drugs is what we use for patients who have hyperthyroid. They inhibit the TPO-mediated iodination and coupling. Inactivation of TPO by antithyroid drugs involve a reaction between the drugs and the oxidized heme group produced by interaction between TPO and H2O2. So that's a lot of the chemical mechanism of action. Simply put, there's excess thyroid hormones resulting in a high metabolic rate, increased heart rate and contractility, and increased sensitivity to catecholamines. The main mechanism of intrathyroidal action of ATDs for inhibition of thyroid hormone synthesis is competition with thyroglobulin tyrosine residuals for thyroid peroxidase, catalyzed iodinization. So iodine organification, therefore decreasing the numbers of mono and di-idoxytyrosines that interfere with TPO. Another complicated mechanism of action. Let's speak of it more clearly in understandable language. These medications will slowly ease symptoms by preventing the thyroid gland from making too many hormones. Antithyroid medications include methimazole and propylthiouracil. Symptoms usually begin to improve within several weeks to months. All right, let's see here. So these antithyroid drugs are actively transported into the thyroid to inhibit T3 and T4, simply put, right? Hyperthyroidism speeds up the body's metabolism and can cause a lot of symptoms like weight loss, hand tremors, rapid or irregular heartbeat. People with hyperthyroidism should avoid eating iodinized salt, fish and shellfish, seaweed or kelp, dairy products, iodine supplements, food products containing red dye, eye yolks, and blackstrap molasses. Um, when we're looking at levels, a TSH above 4.2 is considered high and should be treated. So this is really something that you need to consider. But you'll learn you should know all of that, what the normal lab values are. If you don't, we're going to learn that in our intensive that's coming up before too long. Sometimes we need to use a beta blocker also for hyperthyroidism. Let me see. Some side effects of the medications: joint pain, headache, hair loss, and hives. Okay, let me see. Okay, first drug of choice for treating hyperthyroidism is methimazole. And during treatment, blood hormone levels are going to be monitored periodically. Um, it should reduce the levels of T3 and T4, but T3 may take longer to return to normal. Drugs that can interfere with thyroid function: lithium, tricyclic, serotonin reuptake inhibitors, anti-epileptics, rifampin, metformin, amiodarone. And many diseases can cause hyperthyroidism, like Graves' disease, inflammation of the thyroid due to viral infections, some medicines, or after pregnancy, or taking too much thyroid hormone if you have hypothyroidism. Before taking any medication, it's important to identify if you have any blood disease, like decreased white blood cell counts, decreased platelets, aplastic anemia, or liver disease. It's not a pleasant condition, but it can be controlled. Now let's talk about hypothyroidism. This is the one I think we're most familiar with. Okay, so hypothyroidism, in primary hypothyroidism, there's a decreased production of thyroid hormones by the thyroid gland, causing a compensatory increase in TSH. Okay, that's primary. Secondary hypothyroidism is caused by a pituitary disorder, causing decreased TSH release and decreased T3, T4. Which one is the much more common? The first one. Okay, the decreased production of thyroid hormones. Okay, let me see. All right, so the most common drug used in hypothyroidism is levothyroxine. It's a synthetic T4 hormone that exerts the same physiologic effect as endogenous T4, thereby making normal T4 levels when a deficiency is present. It works by replacing the missing thyroid hormone or blocking its production. In hypothyroidism, thyroid medication replaces the thyroid hormone that the body can't produce in the right amounts. So once you get that hormone level at a good amount, then your TSH is going to balance out, right? It's going to go down. In hyperthyroidism, thyroid medicine blocks thyroid hormone production because the body produces too much. So that's hyperthyroidism, the difference between the two. When thyroid function is altered, there's a series of physiological changes that affect drug absorption, metabolism, or excretion. So there is an altered pharmacokinetics for a variety of drugs in both hypothyroidism and hyperthyroidism. So what that means is that drugs may not metabolize uh, normally if the patient has one of these two conditions. So treatment for hypothyroidism usually includes taking levothyroxine every day. Levothyroxine is readily absorbed following ingestion, similar to the endogenous thyroid hormone thyroxine, or T4. It's converted to its active metabolite T3 in the liver and peripheral tissues by the action of thyroxine deiodinase. Drug interactions with this medication can occur in certain antacids, bile acid sequestrants, ion exchange resins, iron supplements, and calcium. So levothyroxine should be taken at least 4 hours before or after any of those things are taken. And why? Because the thyroxine will lose its efficiency. So it will impair with the absorption of the thyroid medicine. So that being said, you don't want to take your levothyroxine at the same time that you're taking antacids, calcium salts, iron salts, um, or medication used to treat stomach ulcers like um, oh, carafate. Uh, Foods that can worsen hypothyroidism are foods that contain large amounts of iodine, like kelp and seaweed. Um, so want to make sure that you don't do anything, eat those things. That goes in the teaching plan. If you're pregnant, you need more iodine because your baby gets iodine from your diet. So the levels of medication need to be adjusted. Dietary fiber and espresso coffee can interfere with the absorption of levothyroxine, so be careful with that, as well as if you have inflammatory bowel disease, lactose intolerance, or H. pylori infection, or atrophic gastritis. Okay, I think that we have covered the majority of the information on both of those. If you have any questions, concerns, if there's anything that you would like me to expand on, please let me know. I'm developing these slides to be of benefit to you. So if it's missing information that you would like me to add to it, let me know and I can make those adjustments. All right. Thank you.